I've been under treatment here for 4 years, and I know that the staff here are incredibly hard-working, skilled, diligent, and caring. And I also know that these cuts will make all of their work impossible. These cuts are going to be extremely damaging to the life prospects of people like me. It's going to make our lives harder and shorter. There's no getting around that. And the trusts claim that these cuts will not affect patient care, just adds insult to injury. And one other point I'd like to make is that one thing I've learned from my time as a patient here is that there is no distinction between frontline and backroom staff. There are all kinds of people with all kinds of expertise whom, as a patient, I've never personally met, but their work is essential to my welfare. And you cannot cut pathologists, X-ray technicians, and pharmacists, and the people who maintain and repair the equipment, as well as nurses and consultants' hours, without seriously damaging people's health. And so I'm certainly going to be there on Wednesday marching, and again on March 26th, and I hope as many patients as possible join me.
We depend on the nursing staff here to train us, and we already suffer because they're understaffed and they don't have time to do all the work they need in the hospitals, as well as teach us. And there's a real problem in the sense that the next generation of nursing students are not getting the good quality training they're used to, and they'll get even worse training if they sack 200 nurses from here. So if I can just draw your attention to the Bank of America Merrill Lynch building behind us. They talk about not having the money to pay for the services anymore, needing to make cutbacks and efficiency savings. But the fact is that the head of that Merrill Lynch got a £10 million bonus, which would cover all the costs of the nursing at Bart's for 4 years. If you took all the bonuses from all the bankers in Merrill Lynch, that would cover all the costs in the NHS for a year. They wouldn't have to make a single cut. So they talk about not having an alternative. The alternative is take the bankers' wealth. Don't sacrifice the health of patients to pay for the cuts.
We're trying to build as a student movement sort of links between students and health workers, and trying to get the connection that it's not just sort of different groups fighting different things. We can sort of make it a big movement together. I think obviously students will be working in the health system in the future, and what sort of happens now will affect us in the future. But I think in other terms, we need to be supporting them now. Obviously we've got more time, more resources, and we've got a bit of momentum from the student movements, and we're trying to take that momentum and help build it into other sort of movements against the cuts.
I think the march is important because we have to raise public awareness of what the government plans for the health service. It's all very complicated, and it's difficult to explain to people that their NHS is going to change from a public service into a private service. And although they will still pay for the NHS through their taxes, the way that they get services will change dramatically. And some of their hard-earned money that goes in taxes will go straight into the profits and to shareholders' dividends of the big multinationals that will pour into the NHS to plunder the easy parts and leave the NHS to cope with the more difficult parts of healthcare. And people just don't understand how serious this situation is. I sit on the GP committee of the BMA. I represent the union there, and people have changed. When it first came out, GPs were flattered. They thought that they were going to get control of the NHS, and they accepted it, and they wanted to work with the government to make the system work. I think what's happened over the last few months, and particularly over the last few weeks, is that the GPs have realised that this is not what is going to happen. They're not going to have control of the NHS, they're not going to have money, they'll be dealing with cuts, they'll be dealing with closures, and the service that they want to offer to patients, they just won't be able to. Polls are now coming in of not only GPs but doctors in the UK, and they're overwhelmingly 64% against what the government wants to do. So once people understand exactly what this government is planning for the NHS, whether they're doctors, whether they're nurses, whether they're patients, whether they're carers, they begin to understand that this is just not right.
I've worked in the NHS for 27 years, and the reason I'm marching on Wednesday, on the 9th, is because I am just appalled at the lies that we're being told about the ring fencing of NHS frontline services by this government. We're seeing now the true impact of the cuts We're seeing here at Bart's and the London 635 jobs, 200 of those jobs are nurses. We're seeing 3 wards closing, millions of pounds worth of cuts, and we're seeing that not just here at Bart's and the London, but across London and across the country. And I think it's time that the people in this country stood up for their health service, and it's absolutely time that the people that work in the NHS stood up and said, it's lies, lies, lies that frontline services are being protected. That's why I'm marching.